yourself in there. What procedure would be appropriate for multiple lipoma, mixed and bunched, large and small? The best thing for lipomas is excision. And often multiple lipomas, particularly if they're close to the skin, the beauty of it is if they're not close to the skin, they're probably not a bother because they're deep and you don't know they're there. The ones that are bothersome are usually the ones that are close to the skin, which means that they're a little bit more easy to remove. So with multiple lipomas, often you can just do a little incision over the lipoma and pop it out. So you can remove multiple lipomas. And I'm not proud of it, but I have removed like 100 lipomas or 200, like a ridiculous number of lipomas off someone once. It's general anesthetic, arms, legs, absolutely littered with scars. I don't think it was a good thing to do. I'm not putting that down as a good thing, but it just shows you can remove a lot. So it's certainly, possible to remove 10 or more lipomas in a session, lots of little stabs. If you don't mind having lots of little stabs all over your arm or your leg or your tummy or wherever they are. But I think the best treatment is, in answer to your question, Anthony, is excision of those lipomas. And you can get large and small ones. Yeah, obviously larger ones need maybe a slightly bigger cut. And that's the other thing. So I'll probably do it under local anesthetic. That one when I did loads, I'll do that under general. If you really have got loads and you want to have loads done, you could have a general. It just makes things a little bit more difficult in terms of going to hospital, and still could do it as a day case, but it'd be a GA day case. So you could have it if you. It depends on what we're talking here, Anthony. Depends on what you're talking. But if so, yeah, you could have a G. So the anaesthetic would be in question, local or a general. You could take more under a general, but it's a bit more of a palaver, a bit more costs associated with it because you've got to pay an anaesthetist and you've got to pay a hospital. But obviously you could take more out.